Dr. Seth Jarrell again. Today I want to talk to you about what is obesity. It's very misunderstood, but in essence, it's excess energy storage. Many people define it by what's called a body mass index. You take your weight and divide it by your height, and we have to put it into certain units. But a better way of looking at excess body fat is to look at how much fat tissue you have on top of your lean body mass. This can be done with a lot of different techniques. One of the best techniques is called DEXA scanning. We can also use techniques such as bioimpedance or bioelectric impedance. This gives us a pretty good understanding of how much fat tissue you have on top of your lean body mass. People with a lot of muscle tissue, lean body mass, it may look like their BMI is high, when in fact, even though it says that it's 29, they're extremely muscular, and therefore their body mass index is a false representation of how much fat tissue they have in their body. They're still healthy. These are things we can help look at in you. Weight gain can be very genetic. Many genes are passed down from one generation to the next that contribute to weight gain. But on top of that, many things can happen during pregnancy that contribute to weight gain. Many things can happen during your lifespan that contribute to weight gain. Stress, anxiety, depression, traumatic events in your life, whether or not you were breastfed. There are many things that contribute. So each person is completely different, and each person's metabolic rate is different. So it may be harder for one person to lose weight versus another. But it still comes back down to the food that you eat must be burned off. If it's not burned off, it's stored in your body as fat. Each person burns off a different amount. Some of it has to do with their physical activity, but some of it has to do with their basal metabolic rate, how much that person naturally burns. You may know somebody who eats all they want and they still don't gain any weight. They have a high basal metabolic rate. Or you may know somebody who doesn't eat near as much but gains weight. They have a low basal metabolic rate. But everybody has a set point. It's kind of like a thermostat that you use to control the temperature in your house. One person's house might have a thermostat that's set at 72, another person at 75, another person at 65. The same way with our bodies. Sometimes a person's metabolic rate may be set that their body wants to set them at 150 pounds. Another person's body wants to set them at 220 pounds. So what happens is once you get below that point, if I were to lose down to 120 pounds, then my body would kick in and my hunger drive would increase. Whereas somebody who was 220 and wanted to lose down to 190, if they got to 190, their body would kick in and cause them to have increased hunger in order to get to back to that set point. We have a lot of hormones in our body that do this. Some of them are known as ghrelin, some of them are known as leptin. There are many hormones in the body that are actually secreted by adipose tissue, most of the time in the abdominal area. These contribute to our set point. Many things can help lower that set point. Medications, working on our resistance muscle in our brain. Many things can reset that set point, even surgery. Thank you for watching this short video on what obesity is. It contributes to many of the health factors in our life, increasing many diseases. So let's get focused on your weight loss journey. Thank you.